Although it is a fertile land overflowing with nutritious crops, hunger is a devastating problem here in Ecuador, especially in the highlands, Los Páramos. Concealed beneath ponchos, this is not a hunger caused by empty stomachs, but a lack of nutrients. Yet no one understands the cause of blackened toenails, jaundiced skin, and wretched diarrhea. In the Ecuadorian province called Chimborazo, 44% of children under the age of 5 are chronically malnourished. In the community Sigolpito is a small school where teachers track the height and weight of the children. Nearby is a cemetery full of tiny crosses. Here's the community public hospital, where the malnourished come seeking cures for diarrhea, respiratory sicknesses, and intestinal infections. Parasites and diarrhea are two of the most common causes of death here. Malnutrition of children begins before they are even born. If a pregnant woman weighs too little, it is practically impossible for her to give birth to a healthy infant. Dr. Beatriz Molina is a gynecologist working with the pregnant women of the community. She struggles to encourage them to eat well throughout their pregnancy.
With this
point, we can see the relationship of weight to height. When it falls into this red zone, it indicates to us that the patient has lost weight. Why, in the place where crops are abundant, do the indigenous only eat rice, potatoes, and the occasional banana? Because they have no money. They sell all of their products and buy what is much less expensive. They buy rice and other things because what they produce here, like quinoa, is worth a lot more in money. The eating habits of the farmers has, without a doubt, changed. Jean Lopez, director of the public hospital, assures that malnutrition began with the arrival of the Spanish conquistadors. I think it is a cultural problem, a problem of the poor in the rural sectors. They have sufficient living conditions, they produce crops, yet they have a grave problem of malnutrition. When the Spanish became the masters of the land, the Indians abandoned their healthy diets because they believed that the white sugars and flours of the foreigners were superior to their own food. The indigenous now eat pasta, rice, bread, anything to avoid the stigma of being poor. But even more important than social appearances, the indigenous sell their bright vegetables, sweet fruits, fine meats, eggs, for money. Paper bills that they believe hold higher value than their own health. It is this misunderstanding of what their bodies really need that is devastating the future of the community.
A nivel de su desarrollo posterior, hacen retardo en el crecimiento, retardo en el desarrollo.
When children are born to women who are underweight, they fall below normal health levels. They are slow to develop, and this is something that we can't determine at the time of birth. It only becomes apparent with the passing of time. They don't learn to walk when they should. They don't learn to talk when they should. The malnutrition of the mother completely affects the development of the child's brain. The only solution to malnutrition is education. This is an unlikely prospect in a country where the children work in the fields alongside their parents, farming delicious nutrients in which they don't partake.